I am Dr. Chandrika working as an obstetrician and gynecologist in Chirag Hospital, Bangalore, JP Nagar, second phase. I also do a visiting consultation at Malti Manipal Hospital, 9th block, Gynagar, Apollo Cradle Hospital, 5th block, Gynagar, and as also Motherhood Hospital, Banashankari, second stage. Well, bleeding in early pregnancy. There are so many implications for bleeding in pregnancy because it depends on the age of the patient, the duration of time that they have spent in conceiving, and what has happened nowadays. The youngsters, they are not conceiving as soon as they marry, or they take a very long time when they decide to become pregnant. So all the more it becomes more precious pregnancies. For example, a girl by age 26-28 years, when she marries, she never thinks about pregnancy, even maybe 5 years, 8 years later, and 10 years later. And by the time they decide for conceiving, they are so scared and they are so anxious that whether they'll get a baby or not. So they become more tense, and bleeding in pregnancy becomes more anxious. So what I want to tell is, in bleeding in early pregnancy, when it happens, what is the thing is, when the normal embryo, it will go and implant inside the uterus. See, it will come from the tube and it will go and implant inside the uterus. So when it implants into the uterus, there is a small amount of bleeding which happens naturally. That is called as implantation bleeding. And this implantation bleeding is not a pathological one, and it is a routine one. And when I was practicing about 25-30 years back, nobody bothered about that implantation bleeding, and I was also not at all bothered about patient coming for implantation bleeding. But now it has become more important because it's all precious pregnancies only. So everybody comes for any small thing that happens in pregnancy, they come to the obstetrician, they complain about it. So you all should know that implantation bleeding is a normal bleeding. So there is nothing to worry. So what is the difference between real bleeding and implantation bleeding? See, in implantation bleeding, because when the baby just goes and attaches into the uterine wall, that time there is small amount of spotting like, okay. So that is called as implantation bleeding, and it happens and it stops off by itself. So what is the difference between normal bleeding and this implantation bleeding? In implantation bleeding, the bleeding is very, very slight, and it will be just a pinkish tinge or a very small drop of blood or something, that's all. Whereas in real bad bleeding, the bleeding will be more profuse, the blood will be more bright red, and it goes on for more time. And sometimes it may be associated with pain, etc., etc., etc. So this is what we have to think about in bleeding in pregnancy. And one more thing in early pregnancy bleeding is, when the bleeding happens, as an obstetrician, we also bother because they have given us a precious pregnancy, and so we have to see to it that the pregnancy does not go waste. That is what I mean, it should not become aborted. So we as obstetricians try to protect the pregnancy as much as possible. So we'll see the patient, we'll see what type of bleeding it is, and then we have to decide whether it needs any treatment or whether it can be just taken casually. So when obstetrician says, and she is bothered that it is a bothersome bleeding, so she'll take some other measures like physical measures like bed rest, and medical methods like adding on some medicines to prevent the bleeding and to protect the pregnancy so that it will prevent abortion of the pregnancy.